Well, you probably heard some of the people feeling under the weather for a day or two after getting the COVID vaccine, which is normal, but what you may not know is skin rashes can also be a side effect, and they can even pop up a week or two after getting the shot. Courtney standing by with an expert to talk about it.
Yeah, Dr. Agbai, who's been on the show several times, dermatologist at UC Davis Health, joining us to talk about exactly what we're discussing as far as possible reactions, skin reactions to the COVID vaccine. Good morning to you, Dr. Agbai.
Good morning, Courtney. Good to see you.
You as well. Okay, so we've got some pictures of what some of these situations look like that you've actually seen occur. I think the biggest question that people are going to want to know, should they be concerned if they see something like this?
Right. That's a great question. So I would definitely want to encourage everyone who has the chance to go ahead and get vaccinated. The skin reactions that you're seeing shown here are typically very transient. They're mild. A lot of times they resolve without any treatment at all.
Okay.
And what we're seeing here actually is a lesser known type of skin reaction to the COVID vaccine. These are called delayed hypersensitivity reactions. And they can actually occur about a week or so, about 4 to 11 days following receiving the COVID vaccine. So the more commonly known adverse effects of getting vaccinated on the skin would be the injection site soreness. About 84% of Pfizer patients getting vaccinated will experience that. 92% of Moderna patients getting vaccinated to COVID-19 will experience the soreness. That typically will occur about a day or two afterwards and then resolve about 48 hours later. Other types of reactions could be a local skin reaction that also starts about a day or so after getting vaccinated. It could be a little bit of redness or swelling. But the delayed hypersensitivity reactions can occur a week or two later.
Okay.
And if that occurs, don't panic. This is something that's actually been known to happen. It's temporary. It's more commonly seen in Moderna vaccinated COVID-19 patients who've been vaccinated for COVID-19. And this typically will resolve either on its own after a few days or with oral antihistamines.
Okay.
And that's something that you can purchase over the counter. If you experience this reaction, and you can see some of these examples here, that could be a ring-like pattern, kind of a ring-shaped redness on the skin at the injection site on the arm. It could also be just a large round patch that looks red. If you have dark skin, you might not see redness. It might just feel a little bit tight.
Okay.
You might also see a dark discoloration at the injection site. You might see a purple discoloration. It might feel tense. It might burn. It might itch. It might feel a little bit sensitive or tender. And go ahead and let your doctor know right away. Something to try over the counter, as I mentioned, are the oral antihistamines. An example would be Benadryl. It is something you can get over the counter. Another one that's non-sedating would be Allegra. You can try taking a dose of Allegra or something like Zyrtec. And that could help to decrease the experience of the burning, the itching, and help those symptoms go away faster.
All right. Well, it's good to know that as a dermatologist, you have seen it, you're prepared, and if it happens, to not panic. If you have any questions, of course, we're going to make it easy for you to get in contact with UC Davis Dermatology Department on our website, gooddaysacramento.com, under show info and today's date. Dr. Agbai, always a pleasure getting more information and education from you. We appreciate your time this morning.
Well, thank you so much. Good to see you, Courtney.
All right. Take care.